Hello my friend, welcome again to my channel. Now I would like to show you how to deal with severe zonulisis in patients with Marfan syndrome using combination CTR and CTS. The first step is I make 3 side ports at the area with no zonules and 1 main port for inserting the instrument. After that, I introduce the adrenaline, then trypan blue dye, and then I wash the AC, it's like as usual, with saline, and then put some visco. Okay, I try to make another port at the opposite side in order to pull the pupil with the hook. So I hope it can enlarge the view of the anterior capsule. And then I try to make the capsulotomy as central as possible with using blunt instrument to drag the lens to the central area. Then I make a flap with cystotom and continue with Utrata for steps. It was a little bit difficult to complete the capsulotomy from the main port, so I plan to enlarge of the side port and do the capsulotomy from that side with the non-dominant hand. Afterward, I conclude the capsulotomy from the main port again. Yes, I give some more OVD. I'm using HPMC here, and then I conclude the capsulotomy. Yes. Okay, now we can continue to hold the capsule using capsular hook. The important thing is just giving the little tension from the first hook, and afterward you can continue with the second and third capsular hook, and then you can increase the tension slowly. For the step, it's like a regular cataract surgery, but it's a soft cataract, so I did hydrodissection and using only eye tip to aspirate the lens mask, so I just skip to the next step. And for the subincisional cortex, it's a little bit difficult to aspirate from the main port, so I just left it for a while. Yes, now I remove one of the capsular hook and making the peritomy and then grooving at 2 mm from limbus. Now I'm preparing the CTS and put the 6/0 Prolen suture in the central eyelid. Then I make a flange at the one side using monopral cautery. Then I cut the thread. I remove the other capsular to loosen the anterior capsule. So with using visco, I push the capsule backward and introduce the banded 26 gauge needle as a guidance for the 6/0 Prolen to pass through the sclera. Then I put the CTS inside the capsular bag for centration and stability of the capsular bag. It is important to make sure that you put the central eyelid above the anterior capsule and the other part is inside the capsular bag. Then gently pull the Prolen until the capsular bag looks central. Yes. Now I manipulate the central eyelid in such a way to get the eyelid in front of the anterior capsule, and then I pull the suture. Yes, afterward I hold the Prolen with 2 instruments and cut the Prolen, and then I make another flange. Yes, now I proceed to aspirate the remnant cortex from the other port. Yes, I get the cortex easier from this port. Then I give some visco. Then I put the CTR inside the bag. Here I'm using the injector for inserting the CTR because it is easier to compare. With manual insertion. Yes. Now I put 3-piece IOL inside the bag, and then now you can see this is the IOL. Little bit not centered, so I adjust the centration by reheat the previous flange. Okay, now the IOL looks nicely centered. I aspirate the remnant OVD and conclude the surgery with intracameral antibiotics and stromal hydration. Okay, thank you very much for your attention and hope this video can help you in developing your surgical skills. Thank you.